February 2023, the skilled nursing facilities across the country, not just in Connecticut, are in serious trouble. We cannot find staff. We are losing millions of dollars because the Medicaid funds are not keeping up with the inflation. Labor costs are up 25% because we're forced to use temporary agencies and pools, as well as giving massive rate increases to our nurses aides, and all the ancillary staff. Right now, the regulations that we have in place are detracting from the care that we try to provide. Every month, our social workers transmit thousands of data to the Ombudsman's office in the state of Connecticut. We admit and discharge thousands of patients a year, and all this data goes to the Ombudsman's office. As we attempt to recruit every day, advertising on the internet, doing sign-on bonuses, doing whatever we can to recruit, we're still left with not enough staff. The governor's budget in Connecticut did address shortages for teachers, putting over $125 million in the budget to recruit more teachers. For skilled nursing facilities caring for the most vulnerable people in Connecticut, there was no new funding for recruiting nurses aides, nurses, dietary staff, recreation staff, etc. These challenges are real. Nationally, the skilled nursing facilities have lost 200,000 workers. And any new mandates that we're seeing would require another 200,000 workers. That's 400,000 people skilled nursing facilities are expected to recruit. How is that going to happen? We'll show videos today and interviews of staff members that are burdened by regulations, that all they do is sit behind a computer and type regulations. The documentation burden is enormous and too heavy. It is now detracting from patient care. There is so many regulations and so many staff that never get to see a patient because they're documenting regulations, dealing with audits, and intense oversight. Something has to give because things are broken. We would like to get back to patient care. And we hope you'll look at the following video and pay attention and see that our concerns are real. Thank you.
So the MDS department, we complete, of course, MDSs, which is a clinical assessment of the patient that we send to the state to get reimbursement, and also to develop a plan of care for the patient while they're here.
How many questions are on that?
200.
200 questions.
I don't know. Probably
and
more.
Every patient you have to do that on.
Mm-hmm. Yes.
About 200 questions guesstimated. And how many patients do you see us admitting here every month?
At the Manor, we have a lot of admissions and discharges. So for every patient, we do an entry, a comprehensive assessment, and then a discharge on every person that comes in and leaves.
And of course, this is submitted to the state.
Yep.
So it's possible the state gets 500 questions answered, and the state gets copies of this electronically, so they see everything.
Mm-hmm.
They get, really, from a facility like this, in the course of a month,
a lot.
20,000 questions answered about our patients.
Yeah.
Yep.
Oh, yeah, at least.
At least.
Mm-hmm.
And you're a nurse.
Yes.
And RN, LPN?
I'm an RN.
Wonderful. So am I. So how long have you been an RN?
I have been an RN for probably 25 plus years.
Wonderful.
Yep. I was an LPN probably 4 years.
That's wonderful. Thank you for what you do.
All right, thank you.
All right.
Hello, my name is Becky Frazier, and I'm the administrator at Green Tree Manor in Waterford, Connecticut. Today I come to you to talk a little bit about some information that we are expected to report on. Each month, we are expected to generate a report and send to our local ombudsman. In this report, they are looking for information such as, did our resident discharge home? Which resident discharged home? Who did they go home with? What services did they need in place? What VNA did we use? Did we send them home with hospice care? Did we send them to a different level of care, such as an assisted living? And what agencies did we send with them to that assisted living? In addition, we talk often about residents that go out to the hospital. We have residents that discharge from us and go to the hospital. They want to know, did these residents come back to us? How long were they out to the hospital? When did they return from the hospital? Did they return to us? Did they pass away in the hospital? And when did they pass away in the hospital? Did they discharge from the hospital home? What agencies might they have used to discharge them home with? Did they go home with hospice from the hospital setting? And then we also talk a lot about dischargings to other facilities. Often patients need to move closer to their family, or they just are looking for a different facility than what was available upon their discharge from the hospital coming to the skilled nursing facility. What facility did they discharge to? And what was their reason for discharge? These are all situations that arise that we have to generate this report. Each month, my social worker here at Green Tree goes onto the website and fills out this report. As you can see, I have covered the residents' names so that just for HIPAA purposes. But on this form, it's very detailed. It asks for what their insurances were, what their day of discharge was, what their day of death was, what reasonings for discharges, what agencies did they use. This is 1 month example, and then this is another month's example. And each month, these reports have to be filled out and sent in. In addition to that, the social worker generates statistics to find out how many people went home and how many discharges we had in 1 month and what services they may have used and where did they go. And she generates this report and provides the long-term state ombudsman with this information. We try to constantly keep track of the information that's needed. And sometimes it's a lot on our staff to have to continue to have new situations of things that need to be reported. And so thank you so much